knee treatment. Now I am going to give you a little refresher on anatomy, and in particular I'm going to explain to you where the cruciate ligaments are situated. Now this picture is very clear. The bone above is the femur. Underneath we have the tibia and the fibula, and in the middle between tibia and femur we have two ligaments which are called posterior cruciate ligament and anterior cruciate ligament. These ligaments are important because they keep the tibia and the femur fastened together in the anterior posterior movement. In other words, they allow the knee not to slip out of its seat. To help these two ligaments, we also have the collateral ligaments. One is more exterior, which is the lateral collateral ligament. Inside the knee, on the other hand, we have the medial collateral ligament. It's called medial because it's situated in the middle line of the body, or in any case, closer to the middle line of the body. Now, all these ligaments obviously can break down. It happens often. You may have come across it of some player or skier who has had a ligament rupture. Here you can see another picture of the ligaments. Now, you see in particular in the center of the screen, you will see the anterior and posterior cruciate ligaments. You can see how the collateral ligaments are also bigger. Now, what we need to do with knee treatment, in fact, it's more than a massage, it's a real treatment, is to do exercise and loosening the tension so as to provide a greater blood supply to the area, so that if there is an inflammation in the knee, by providing more blood to that area, this blood will wash away all the toxins that tends to cause the inflammation to be more enhanced. The same applies to the meniscus. In this picture, you can see them. They're indicated. One is on the right and one on the left, but in fact it can only be one, but sometimes we find it separated in the center, so we're talking about meniscus. These are two discs of cartilage that separate the tibia from the femur and help the movement. When these break or fracture, we need to go for surgery, but with the main technique that I'm now going to show you, which is the palpé roulé technique, we can alleviate pain significantly. And in any case, we can help them until they actually go for surgery. But of all the people that come to me with knee pain, except for those who have fractures, by doing this palpé roulé technique, which is the main technique of all the techniques that I'm going to teach you for knee treatment, is really effective, especially in the 2 following days. So, as I shown you, first we work on the kneecap. I have drawn the kneecap here, and then we do the palpé roulé. This alleviates all the adhesions and all the surrounding tissues surrounding the knee. This improves blood supply, and always tell the person that in the next 2 days after treatment, it will tend to swell. And that's normal. In fact, that must happen. In other words, if you do the treatment today, that person will start to swell the day after and the day after that, usually 1.5 to 2 days. So tell them that they're going to see a swelling, because that's the blood supply that will wash away the toxins, and then it will deflate by itself. If you prepare the person in this manner, they will not be afraid, and they will accept that feeling of almost being struck. Because with this palpé roulé technique, the skin will feel swollen. It's nothing serious anyway, don't worry. Now, moving on with the video, I'm doing the palpé relais over the knee and underneath the knee. Cruciate tests. Okay, now we have to perform a cruciate ligament test. Now, cover the foot and sit on it so that when you do this, the knee will not slip forward. Okay, so hook on to the tibia, to the calf, and pull towards you and push away from you. This is a test. If you do as I'm doing here, so you pull the tibia and the tibia slips out of its seat too much, that means that the ligaments are damaged. So you will notice that as you pull the tibia towards you and comes out of its seat, well, if you see that, don't insist. That means that the person has a broken ligament. So it's either the anterior ligament when you pull or the posterior when you push. And when you see that the knee or the tibia slips out of its seat, then you know that it's a fracture. Stripping of the knee. Now, given that the customer is already in this position, we can do the stripping of the knee. So you hook on to the kneecap and you coast along the kneecap in a circle movement. You do this always, these circles are increasingly larger. Start always from underneath the kneecap, press and strip. This is a good exercise for alleviating the stiffness in the knee and all the surrounding muscles. You can also work on the collateral ligaments and the lateral side, and consequently you will improve the mobility of the knee. You do this 10 times. Mobilization of the kneecap. Okay, now ask your customer to lie down and to with their knees and legs, and you do some movements with the kneecap. You have to kind of play with it a little bit. So you hook on with your fingers, you push it forwards, backwards, up and down. Now I'll show you a blow up of this. You see, you push it. This helps the mobility of the kneecap. It's important that the kneecap moves because its task is like it acts as a pulley for all the quadriceps on the rest of the body. So as this pulley, this kneecap stiffens, then it can increase the pain. But it also helps knee mobility. But it also decreases pain because this balance of forces is somewhat offset. So you take it and you work on it for 2 or 3 minutes. Breadstick movement. Okay, now we have to do what I call the breadstick movement. Now, how do you do this? You grab the ankle, you put your hand over the kneecap. You see, with my left hand, I press down, and with the other one, I pull upwards. Now, as you can understand from the name itself, breadstick, why is it called breadstick? Well, because like a breadstick, it has a little bit of elasticity, but if you exaggerate, then it will break. Now, I didn't want to really teach you this technique because I'm afraid that you do some damage, but if you do it in a conscientious manner, and you will, I'm sure of that, then this is very useful. So, I repeat, grab the leg with one hand, you hold it downwards, and with the other one, you pull the leg softly upwards. If the person feels pain, obviously you stop. So all these breadstick movement and all the other exercises that I've shown you, other than the palpe rouler. If there is a prosthesis, if the person has a prosthesis, then don't do them. Palpe rouler of the tissues. After having completed the steps that I've just shown you, then you can do the palpe rouler. You see how the skin is pulling away from the underlying tissue. Now this is what I call the main technique, because it's the most effective one in terms of knee treatment. And it's too bad that I haven't shown you my model's face, because she is really showing pain in her face. As I was saying in other videos, you have to always ask your customer to have some patience. Now, you see how it's difficult to do the palpe rouler here, because the skin doesn't come off, doesn't pull away from the underlying tissue. Now, where you have this problem, that means that the area is most painful. Now, you don't have to do this in one session, but in 2 or 3 sessions. Reflexology. Okay, now you have to work on the foot. You have to draw the most protruding bone, which is the 5th metatarsal bone. You draw a circle around it, and then we identify the metatarsal bone on the other foot. For both knees, we need to work on both feet. And now I've gone back to the left foot. Now, don't get confused now. I'm going to now work on the joint of the 5th metatarsus. Now, this exercise can be compared to the work that you've done around the kneecap. So think of this point as the kneecap, and then you just have to stimulate it all around it. Don't worry, don't even think twice of neglecting this step. I don't want to threaten you, but it's very important, as I was telling you in the other video, for knee pain, for elbow pain, for shoulder pain, for any pain in the joints in reflexology. This is very effective, but you have to do it first in a surgical manner. So you really have to be very, very specific in the joints. You have to do it with passion, and you will notice that it is very effective.